Good morning and good afternoon, everyone. My name is Suki Steckel. I'm the System of Care Lead for INTAC. So excited to welcome you all to our last of our concurrent sessions this afternoon. There is so much for us to learn today from the folks in Hawaii, which I will just say it is very early in the morning and I'm over there and I'm very grateful that they have joined us. So I have just a couple of announcements before we get started. First and foremost, I really just want to recommend or just remind everyone that we have a commitment to maintaining a safe and accountable space. And if you experience any issues or need assistance in any way, please reach out to me directly using a direct message that you can find in the top right corner of the event screen. And if you've attended these sessions before, you probably know there's a vertical menu bar right next on the right side of your screen, and you can access the resources using the icon that looks like a stack of paper. Please put any direct questions to the speakers in the Q&A, and please engage with the speakers and each other using the chat function. And if you need to step out at any point, please do so. We want you to take care of yourselves, and then we are supporting all of you using the wellness room that some of you may have already engaged with. And so without further ado, I am going to pass it over to our team from Hawaii, starting with Danielle Carrera-Ching, Kelsey Okamura, and David Jackson. Thanks so much.
Thank you, Suki. Okay, good day, morning or afternoon, depending on where you're at in the world. We're in Hawaii. It is 8 o'clock in the morning in Hawaii, so good morning from Hawaii. I will really quickly do some brief bios for the team here today. So we have Dr. Kelsey Okamura. Dr. Kelsey Okamura is an implementation researcher at the Baker Center for Children and Families, a Harvard Medical School affiliate, and a licensed psychologist. She is currently funded through the Substance Abuse and Mental Health Services Administration and has received funding through the National Institute for General Medical Services, Robert Wood Johnson Foundation, and American Psychological Foundation. Excuse me. Dr. David Jackson is a research and evaluation specialist at Hawaii's Child and Adolescent Mental Health Division, has been involved in various evaluation roles on 5 of their SAMHSA grants. He is the director of evaluation on the current Data to Wisdom project. And then there's me, Danielle Carrera-Ching. I am a 4th-year doctoral candidate pursuing my PsyD in clinical psychology at the Hawaii Pacific University and a research assistant with the Baker Center for Children and Families. And I've worked with Hawaii's youth for the past 18 years in various capacities. And we're very happy to be here with all of you wonderful folks. So we are technically here from the Baker Center. I'm going to switch to my slides, so I won't be able to see anything. But so we're here from the Baker Center, a Harvard Medical School affiliate, and we're here to share with you 30 years of lessons learned, Hawaii's partnership with the Substance Abuse and Mental Health Services Administration. Actually, I can't remember if we wanted to do poll 1 first.
I think there are 2 questions already available. It looks like some people have already started to answer. So yeah, we could start with that.
Yeah, if folks want to do the first 2 polls, I think. Oh, there are 3 polls. Yeah. 2 polls. So how many SAMHSA grants have you been involved in, and have you been involved in SAMHSA grants projects before? I think the status doesn't show up on my end, so.
I'm seeing some
good
numbers come in here, yeah. I'm not sure how many people we have attending this, so maybe we'll wait 10 seconds or so and show the results.
Sounds good.
All right, looks like we might have about 20 people in here. I'll attempt to show the results here. Let's see. So the first question, have you been in SAMHSA grant projects before? Oh, majority of folks here. 83% said yes. 17 people. 3 folks said no.
Pretty good. I just
So-
realized you can't see the results until you vote.
Oh,
So that's why I couldn't see it. I had to vote.
Oh, I see. Okay. Okay. So great audience for our discussion
Definitely,
today.
yeah.
Shall we go to the next one?
Yeah.
Okay. I think I hide. And the second question is, how many SAMHSA grants have you been involved in? So majority of folks have been involved in one. Couple people, many involved 2, 3, or 4 grants. Great. So maybe people will have some good feedback on multiple themes they've seen from multiple grant projects. All right. Thank you for participating, everyone.
Thanks, everyone. Okay, so we'll talk agenda. So we have a brief introduction to sort of our team, which is a little complex. We'll talk about the goals of this particular project, the method, the findings, take-homes, and recommendations. And we'll jump around between myself and Dr. Kumar. We have some acronyms just for good measure. So feel free to screenshot, or if these are just, you already know all of these, then that's awesome. I often am like, what is that again? So I like a cheat sheet. So these will be used throughout the presentation as well as in some of the figures. And if anyone has questions, please put those in the chat. And I think David probably knows them pretty well. So, or Dr. Jackson knows them pretty well. Okay. So we have a short video on the Baker Center. Our mission at the Baker Center for Children and Families, formerly or also known as Judge Baker Children's Center, is to promote the best possible mental health of children and families through the integration of research, intervention, training, and policy. Our staff work collaboratively with families, service providers, schools, state agencies, academic institutions, and funding organizations to help ensure that all children and families have access to the highest quality care. So we thought we'd show this very brief video on the Baker Center. And there should be sound, so.
I was angry and sad and depressed a lot.
I would wake up in dread, having to face the morning with my child.
Jack spent a lot of time being told he's a bad kid. You're a bad kid. This is all the ways in which you were bad today.
When we go back to the very foundation of the Baker Center, we find Judge Harvey Humphrey Baker.
Judge Baker was a little bit of a visionary and said, you know what, these kids aren't really delinquents. They really need our help. So he began using his position to bring services and supports to the children of Boston. And when he died, they created a foundation in his honor, which was the genesis of the Baker Center. I like to describe our work by the fact that we're working at the policy, systems, and practice levels.
Working to make sure that the decisions that are being made at those highest levels of government are research informed, driven by data, or driven by science.
A lot of our families come in and they feel like they have to fight for their kid. And what we try to show them here is we see this amazing person that they are, and we see the areas where they need support. And we want to try and offer that support.
Every family, every child, irrespective of what language you speak, where you were born, what neighborhood you're from, what color your skin is, we all deserve the kind of care and support that is going to help us get back on track.
Our job is to help people understand what it is that they're struggling with, teach them skills that they can use to manage those struggles, and then fade ourselves out so they don't need us anymore. That's really, really empowering because it's not a life sentence, it's a life skill.
They're like a therapy that you're trying to train yourself out of a job so that we can do this.
He's not a bad kid at Camp Baker. He's got stuff to work on. But yeah, you bet he was up early. You want to go hear that message? This kid's been, living his whole life waiting to hear that message.
This shift in Henry's behavior was just so abrupt and so positive and so hopeful. It seemed like magic, but it wasn't. It was science.
I always felt I had somebody there.
Those people are loving professionals. They are teachers, psychologists, social workers. Those people walk through that door every day to say, I'm going to help make a difference. Because to the core of our work, to the core of our being of the Baker Center, it is for the children.
For every trainee that we work with, for every agency that we work with, the impact on kids and families is incredible.
The Baker Center brought it back to me enjoying my child again. Everything just became more and more hopeful.
The Baker Center's given me my child and given me a chance to really see my child for who she is.
Not only academically, but just the whole child. I mean, they really, really care about the kids.
Okay, always enjoy that video. It wasn't until this time, though, I realized, hey, I know some of those people, so I'm more integrated now this time around. So talk a little bit about our team, our Baker Center team. David is a part of our CAMHD work. So this is our Baker Center team. We're a small team nestled within a much larger organization. And in our work, we collaborate with a number of agencies and organizations, one of which is CAMHD, Hawaii State Child and Adolescent Mental Health Division. And that's what we're here to talk about today. Okay, so a little bit about CAMHD. So the Hawaii State Child and Adolescent Mental Health Division, or CAMHD, provides mental health services free of charge for eligible children and youth in Hawaii who have severe emotional and or behavioral challenges. Services include assessment, case management, and an array of therapeutic supports provided in the home and community or temporary out-of-home placements. This is the organizational overview of CAMHD. So CAMHD serves approximately 1,800 youth per year statewide in Hawaii, ages 3 to 20, youth with significant functional impairment in their home, school, or community, which qualifies them for a mental health diagnosis. So in CAMHD organization, the central office coordinates and directs the efforts across family guidance centers and on the far right, Family Court Liaison Branch, which serves all of the justice-involved youth in the state. So these family guidance centers and the Family Court Liaison Branch broker and co-manage services through contracted providers contracted provider agencies that deliver services to youth and families across the state. Okay. So services that CAMHD provides are intensive case management, co-management of treatment services in collaboration with a CAMHD psychologist and or a CAMHD psychiatrist. They provide home and community-based mental health treatment based on youth needs. So this can include intensive in-home therapy, transitional family home programs, crisis services, residential services, hospital-based services, as well as evidence-based programs like multisystemic therapy and functional family therapy. And I will hand it over to Kelsey to talk about the goals of this particular project.
Thanks so much, Danielle. So the Child and Adolescent Mental Health Division has had a long-standing history of receiving funding through System of Care Expansion Awards through the Substance Abuse and Mental Health Services Administration. And so part of the goal from the Baker Center and CAMHD partnership was to try to understand that history and understand how the funding has impacted System of Care expansion throughout the many, many years, 30 years. appreciating the expertise in the audience. I'm sure some of this is going to sound pretty familiar, but we want to make this as interactive as possible. So please, as we're going through things, feel free to put things in the chat, use the Q&A function. We want to hear how this is really kind of resonating with you in this virtual space today. Our goal was really to develop a timeline for system of care efforts. What we heard anecdotally through many years of system of care improvements was that, there's a lot that's been learned, yet not really documented. And so we wanted to be able to kind of document some of the bigger system changes and also try to timeline that out to see how long it took for certain changes to happen, which is really important. As we saw in the poll, many of you have been involved in 1 or 2 grants, trying to anticipate kind of the next step for your system of care improvements and kind of what are some of the lessons learned that we gleaned from some of those things. So that was our main goal, to identify those common themes and share those lessons learned. And so the way that we did that was through a kind of multiple method, qualitative analysis of content analysis of final reports. So appreciating the expertise here again, at the end of each grant, you are required to do a final report, kind of detailing all the system of care efforts and kind of grant goals. We took 7 final reports from the 7 grants that CAMHD received and did a content analysis of that, those final reports. We used a rapid qualitative analysis, which is kind of well suited for projects like these that aim to be completed in kind of an ongoing and kind of iterative process. And so David and I took main points from the focus groups and we summarized them to provide a quick and accessible sketch of what was going on. And those sketches were organized into this very dense spreadsheet that David probably doesn't want to ever look at again, to allow for quick identification of similarities, differences, and those trends in the responses. So that was kind of the thematic coding that we did. We took the findings from those final reports and our kind of thematic coding, and then we did key informant interviews with current CAMHD leadership and past CAMHD leadership. We talked to past project directors and some of our academic partners to understand kind of what are their thoughts about some of these themes, and to give their reflections on kind of how, any lessons learned and kind of reflections on the themes moving forward. So this next slide is really kind of an overview of all the SAMHSA and CAMHD projects that have happened over the years. We recognize that it's very small. We're going to go into each one in detail, but you can see that, from the start in 1994, I think SAMHSA was established in 1992. So 1994, CAMHD received their first System of Care Expansion Award. And it has consistently gotten funded for different kinds of projects, specific to specific populations and sometimes more about system of care expansion. From 1994 to 2024, we're ending we're in our last year of the 7th System of Care Award. Okay, and so we'll go into detail of each of these different projects in the next few slides.
Thank you, Kelsey, or Dr. Okamura. Okay, so I'll talk about the first project. So Ohana Project was the first System of Care Award, focused on promoting systems change through the development and demonstration of the System of Care approach. Kate Pahinui was the project director. And this was the first project that tried to establish a system of care and care coordination model where providers and contracted providers delivered direct service, and the system of care helped to manage and authorize those services. It clarified different roles within the child serving system, particularly within the DOE, family court, child welfare, and it integrated a lot of family voice in governing councils. And this was the first time that we started to see things like youth and family participating in system of care expansion and system of care improvement initiatives. Some of the lessons learned here were that the state personnel structure was difficult to navigate. So there's significant delays in hiring. It was the first time that CAMHD started to look into this managed care and private insurance landscape, where previously direct services were provided within family guidance centers. So this really took the managed care model and started having CAMHD look at different kinds of insurance and reimbursement structures for the system of care.
The second project that CAMHD CAMHD did was the Cultures of Engagement in Residential Care, or CIRC. This was not necessarily a System of Care Expansion Award. It was geared towards seclusion and restraint within residential treatment settings. The project director was Leslie Slavin, and what they did was create a provider agency best practice network through kind of a learning collaborative with family guidance center teams as well as contracted providers. The big policy that came out of that was a policy on seclusion and restraint, which still lives in CAMHD kind of guidelines right now. And it also focused on trauma-informed care, so ensuring that youth and families were being treated, in residential settings through this kind of trauma-informed lens. It was the first time that we started to see some youth and parent involvement within the System of Care awards and grants. And the lessons learned from this project was that networking between and within agencies is important. Creating that learning collaborative is really helpful in fostering kind of shared responsibility and, learning lessons from different organizations, which really help to create this responsibility around seclusion and restraint. However, policies are important to sustain practice, but CAMHD learned that they really needed to be careful about mandates because sometimes mandates had an unintended consequence of, people just kind of reporting what they think they want to, people reporting what they think they should be reporting rather than what's actually happening and not getting, support around kind of changing their practices within the organization. This was the first time too that, with this care coordination model and contracting providers out, that we started to see turnover impacting agencies a lot more. And so when there was turnover within agencies, there was a need to retrain and kind of get policies in place again in order for people to understand. And that takes some time. So turnover was really kind of impacting the extent to which they could actually enforce the seclusion and restraint policy. I noticed, Danny, before you go on, Suki had a good question in the Q&A about how this overall project was funded, and David responded that the current grant, Data to Wisdom, which we'll talk about last, supported the research for this project. Thanks for the question, Suki.
I can hear the rain in Dr. Okamura's video. It has been raining in Hawaii for like a week, and it's not supposed to stop. So the third project was Ho'omohala, and the project director was David Leek. The goal of this project was to culturally and linguistically assess, adapt, develop, evaluate, and sustain a seamless system of care through the integration of comprehensive array of age-appropriate services and support and targeted policy and system activity. So similar to Ohana Project, which was geared towards establishing the system of care, Ho'omohala was really focused on improving and sustaining that system of care. And they did this through partnerships with state senators, family court judges, and other legislators. They started to look at the kind of policy level in order to sustain some of the practice that they wanted to see for the system of care. And it was the first time that we started to see things like public service announcements and digital media to promote system activities. Parent and peer partner support services were being developed. And so in addition to having youth and families participate in advisory councils, They were also starting to intersect with individual families and supporting individual families and youth in their treatment. They developed different types of engagement categories to engage youth and families in CAMHD services as a means of trying to increase the uptake of any kind of CAMHD support. Some of the lessons learned here were that certification and payment can impact hiring processes. They saw that across the board, or we saw that across the board, especially for youth and peer partner support services. Certain payers and reimbursement structures required a higher level of education than what was happening on the ground. And that was representative of folks who were actually delivering the services. So this really impeded the extent to which they could hire youth peers that would be closer aligned with youth who were actually receiving services within CAMHD. And then for this project, like given the focus on cultural and linguistic access, the theme of culture emerged as an important caveat about sharing mental health, and just sometimes that it takes bringing people together to talk about non-mental health related topics in order to start the conversation around how people are doing as far as like well-being for youth and families. So they used a number of different strategies to try to bring people together regardless of the focus on mental health or not. Another lesson learned here, and pretty consistent with other projects, was that contracting was delayed by several months, which impeded the progress, especially at the start of the project.
So the next System of Care Expansion Award was called Ke'alaho. The project director was Tia Roberts. And the goal was to build trauma-informed, gender-specific, culturally resonant programming for adolescent girls or those who identify as girls who have experienced significant trauma. It focused on non-coercive treatment at youth and family level and interagency education, advocacy, and collaboration. And so similar to other projects, the trauma-informed training used a learning collaborative approach and policy development. So there were funding strategies like nonprofit and legislature that kind of went in to sustain some of the work of Ke'alaho, and interagency collaboration within government as well as community-based organizations. The way that they really sustained some of the programming within Ke'alaho was leveraging the CAMHD organizational chart and establishing positions within CAMHD in order to sustain the program long term. This is also the first time we started to see payment for youth and parent partners through kind of advisory councils and also kind of a standalone service. Some of the lessons learned here was that, information sharing at the federal and state level was sometimes a mismatch. So reporting to kind of federal funding agencies like SAMHSA and the priorities that were happening down at the state level were not quite aligned. And so sometimes there was a need to kind of iron out kind of what really is the priority and how can we get them, get the project moving on the right track. Another lesson learned was that, basic needs are essential to mental health. And so, things like transportation, food, just having a shared space to build community, and that trauma-informed care takes time.
Okay, the next project was Project La Lima. And the director was Fatima Musburger. This project was focused on providing accessible, effective, and sustainable treatment options and support in communities. There was also a mission to include collaboration efforts to strengthen partnership across Hawaii's child serving system and to provide training opportunities and technical assistance to families and professionals caring for and working with children and youth in mental health and intellectual or developmental disabilities across Hawaii. So this looked at those kids that maybe fall into gaps where they may not meet criteria for DDD services, but they would get enrolled in CAMHD services or get identified for behavioral concerns where truly potentially there was an intellectual or developmental disability concern. So they tried to meet these goals through interagency collaboration. There is a formal MOU established to help the child serving system come together. That brought about the interagency child service system called the Hawaii International State Youth Network of Care, or HISYNC. This helped to formalize the legislation to make it into a revised statute. They also championed a multi-agency consent form, which is actually born out of Kealoha project, the previous project. And Kealoha introduced this idea of a universal consent throughout the child serving system. And then LaLima brought it to fruition through the formal MOU, getting all of the AGs together in order to establish that multi-agency consent. There was system and youth level dual diagnosis coordination through a multi-interdisciplinary evaluation team. And they developed a new intervention called adaptive behavioral intervention and used a train the trainer paradigm to sustain and train providers in that particular intervention. They also expanded the statutory definition of developmental disabilities. And so one of the lessons learned here was that interagency problem-solving architecture, like HISYNC, can be helpful in coordinating child serving systems to address not only systems needs, but individual youth needs as well.
The next project was called Kaeru, and what Kaeru means to return home in Japanese. The project directors were Yasmin Cheney and Tia Roberts-Hartsock, and the goal was to return CAMHD enrolled youth who are currently placed out-of-state residential treatment facilities back to their home communities in Hawaii, and to prevent impending out-of-state placements. And so the goal was to really implement high fidelity wraparound. And they tried to accomplish this through many different kind of tasks within the project. So peer and parent partner certification was explored as it is an essential part of kind of engaging youth and families into treatment. They also implemented a crisis text line, which I think, given the time, it was kind of a national priority to get the crisis text line out to consumers. And they developed a data-driven referral method in order to identify youth and families that would benefit from high fidelity wraparound. And if people have questions about that, I think David can speak more to what that data-driven referral method was. I think some of the challenges and lessons learned was that, for high need multi-agency involved youth, high fidelity wraparound requires a lot of kind of coordination and communication, and that was particularly challenging in our system of care. And this was also the time when COVID-19 hit, and a new case management system that was being implemented in CAMHD really impacted the progress of getting kind of the services out into the entire system. So lots of kind of external forces that were kind of impeding and were potential barriers for getting services out.
Okay. So the last or most recent project is Data to Wisdom. And the project director was formerly Tia Roberts-Hartsock and currently Charlene Takeno. The goal of this project is to build a knowledge management approach that infuses various data from user, provider, and systems to inform decision-making. So the focus here again is really enhancing the system of care. A particular goal was to establish a statewide trauma-informed care task force, which was not an initial overall goal, but started to sort of evolve into a major focus, given that legislative priorities and the fact that DOH and CAMHD were named to chair that task force. Another goal was to strengthen HISYNC to improve resource sharing and coordinated system planning, to establish a system-wide infrastructure to synthesize all forms of evidence into a clinical knowledge management system. And these are the current goals in this final year. of the project. So some lessons learned thus far, or at the point of this project, were that state procurement and contracting delayed some of the grants deliverables and progress. And that was also complicated by the COVID-19 pandemic. I did also just want to say that I think what's really interesting about all of this for me as a trainee is just that I started out working with youth within the system. And then it's really cool to get to kind of come and see all of the things that go into after having seen those services in work. So it's really cool and really rewarding. So.
Thanks, Danny. So that was an overview of all the different projects. Are you now ready for the test? I'm kidding. There's no test. So based on those 7, different system of care awards and projects, we'll call them projects, when we did that kind of content coding and thematic analysis, and we organized them into topic themes and process themes. And what topic themes are areas that kind of require long-term consistent effort across multiple grants to develop. So I'm going to go over 2 topic themes, and then Danny's going to go into some of the process themes. So our first topic theme is interagency collaboration. I'll just wait for the slide to go over. Thanks, Danny. I recognize that the text is very small, so hopefully the resources will help you kind of look at, the text individually. But this first topic theme we called interagency collaboration. So from the start of SAMHSA projects, the Ohana project, CAMHD coordinated interagency agreements with other child-serving systems such as the Department of Education and Child Welfare. Through the execution of additional system of care awards, these child-serving systems existed to serve as governing and advisory groups for the System of Care Expansion Award. There was also consistent integration with other direct service provider agencies and academic partnerships to support the System of Care expansion. During Kealoha and Laulima, there is an effort to formalize the interagency collaboration, which meant execution of MOAs and targeted strategies to improve system collaboration, like universal and multi-agency consent forms. The formation of High Sync through revised statute furthered the commitment to interagency collaboration, which CAMHD co-chaired, and later a project director served as the co-chair. So if we had to think about it, next slide, sorry, Danny. It really started kind of as an interagency collaboration started in more of an advisory role, and then it got integrated into some of these system of care awards. And then CAMHD began to lead some of that interagency collaboration. And we see that through some of the quotes from key informants when we had them reflect on this kind of topic area of interagency collaboration, that it was important, but, really challenging to achieve. So, as one informant noted, if it's not seen as a priority, so if interagency collaboration is not seen as a priority, or if there's limited engagement, like it's only going to happen for 1 year, people are thinking, do I need to make this a priority, or really try hard to make something happen where there could be a lot of process involved when they have full plates and many other things to do. So in the sense that it is really helpful, but it's challenging to find time to prioritize, interagency collaboration. Okay.
Kelsey.
Yeah.
Can we do a poll question here?
Yeah, that'd be great.
So as you can see, interagency collaboration was a very long process for CAMHD and went through multiple grants. So we were curious if your grant has engaged in interagency collaboration, how much time and resources were required for your system? I'm going to try to publish this one, and I'm not sure if this is going to work.
I see it.
Oh, you can see it? Okay. I know there's been some research about themes across the whole SAMHSA grant process, and I know interagency collaboration has been one of those areas that has been a challenge for a lot of sites. So we're curious what folks here had to say about it.
Mhm.
So we have some votes coming in. I think I need to show this on stage, right, for everyone
Yeah.
to see?
Mm-hmm.
Okay.
Seeing a little skew in the data.
Yeah, so most of them, majority are a lot and quite a bit. So
Mm-hmm.
folks having similar experiences as we did.
Mm-hmm. Yeah, awesome. I'd be curious to hear from folks, and I think we'll have time at the end for some question and answer. I'd be curious to hear from folks any strategies they've used and, around interagency collaboration.
Yeah, that's great to know. Thanks for participating, everyone.
Awesome. All right. Our second topic theme was youth and family voice. And we saw the integration of parents and youth into governing councils and advisory boards for grant activities from the first award, Ohana Project. And there were several community-based organizations like Hawaii Youth Helping Youth that supported youth and family voice through identifying and training advocates. These advisory activities continued with more applied support to individual families and to youth occurring in Project Kealoho. So during this project, the priority was to develop a sustainable infrastructure for youth and parent partners supporting individual families. Medicaid reimbursement was pursued for the first time, and this effort continued for about 12 more years into the current system of care award data to wisdom. So the current focus is developing a youth peer partner certification as a step towards successful Medicaid reimbursement. And so when we think about it, again, early on, the Youth and Family Voice was serving kind of as an advisory board, and then it started to inform service. And now CAMHD is pursuing a standalone service for both youth and parent peer partners. And we see that, in the key informant interviews, that the challenge with youth and family voice is in building trust across different levels within a treatment team and a system of care. David, Danny, and I certainly learn from the youth partners that are a part of the current system of care award a lot about language and being careful about the language that we select as a key moderator of trust building. And as one informant mentioned to us, there were meetings where there were things that were being said, in care coordination meetings that were being said that were offensive to the youth peers. And so there was a lot of work to do to prepare and debrief the youth peers after they were in meetings, the secondary traumatic stress and the triggering event that the peers was intense. And so there was a lot of work that with that had to be done in order to address some of the secondary trauma and just the language that we were choosing in that.
So we have another poll question similar to the last one. So this was an area that was very long-term and prominent for Hawaii too. So we want to see what your experiences were. Did that work? Let's see. So the question similarly was, if your grant has worked on youth and family voice, how much time and resources were required for your grant? Are you guys seeing? Okay, I do see some coming in. Okay. Let me show the results of this one. Okay, looks like similar experiences with everyone here too. Very interesting. I think that's very validating for us and the challenges that we've been going through in Hawaii too. Yeah, so majority saying quite a bit and a lot. Very interesting. All right, thank you, everyone.
Okay. So switching gears to process themes. So the first process theme is connection. And we conceptualize connection across these three major areas around youth workforce members and agencies. Kelsey and David heard from informants that the process of connecting with youth to strengthen family, community, and culture is vital to system of care success. So communication and relationship building among workforce members is important, as informants noted, reflecting on learning collaboratives. So building connections between staff and building it into the day, not just on our own, but really kind of taking time throughout our days and weeks to come together in different ways and connect. Another informant noted, I think the training mechanisms of learning clubs are really important because that creates community. And I think that's something that is under-recognized, how important those collaboratives are, just not one-off, but like these long-term ongoing structures. Finally, interagency collaboration, again, was a focus of connection here. As one person noted, that was a big thing, I think, was the impact of utilizing a governing body to come together and collaborate, build relationships with. We would meet in here, we met in this room every month, and building relationships from that. So several things came out of that. And the connections not only built trust and clarified roles, but created shared responsibility within the system of care. So not one organization or body was making decisions independently of another. Okay. The second process theme was continuity. And we noted a few different domains that emerged, including the importance of sustaining interagency collaboration, needing longer periods to develop systems than in a single grant, defining the CAMHD model, the importance of trauma-informed care, and building sustainable infrastructure and maximizing continuity in staff. So building upon that shared responsibility and interagency collaboration, one informant noted, I think the relationships that have been built from here, where people are from those groups, are still working together heavily with me. And as seen in youth and family voice domain, it does take longer than a single grant to see any sort of transformational or long-term change. And so the CAMHD model emerged as a consistent topic throughout the final report and key informant interviews. As one person noted, we need to figure out what our model is. So truly, really understanding what CAMHD wants. So as mentioned, related to youth and family voice, trauma-informed care was a consistent thread in all system of care awards, and the importance of continuity emerged in the interviews. And we know that it takes time to do trauma-informed care. As one person noted, you can only move as fast as the individual is able to move. So the importance of sustainable infrastructure emerged when talking about projects that focus on developing a standalone service versus those that were targeted at system of care enhancement. And as one person noted, it's kind of a problem if you have a standalone service with its own team and it's going away when the grant money is gone. So, you know, one consistent challenge, and the reason why I think Kelsey and David did this work was to maximize continuity and staffing. So unless a grant from the start is building and hiring people for grant work, it's hard to have continuity across grants and integrated into the system. And it's slow to get absorbed over time. Did we have a poll for that? No. Yes? No. No. Okay. Some take-homes. So take-homes that are noted. There were two consistent topic focus areas that have developed over time, that youth and family voice and interagency collaboration makes perfect sense considering that SAMHSA funding priorities and that specific call for system of care expansion. So those are key items that are integrated into all system of care awards. Additionally, process, i.e. implementation, is critical. So there are themes around connection and continuity that emerge that could potentially be areas that can be improved to enhance some of the system of care awards moving forward. A common thread that emerged too was the state and federal mismatch. So that we see in like day-to-day practices of trying to execute federal grants within a state infrastructure, and also different funding restrictions and revised statutes and administrative structures that are there to protect taxpayer dollars, but can also hinder, the alacrity under which we can execute contracts and spend funds. One thing that came through was that sustainability starts even before the grant application goes in. So a lot of thinking into how this is going to get sustained in the future when grant money is no longer there.
So we have a few recommendations based on the findings, but it's important to kind of situate some of the recommendations in the limitations of, our study. So, this was purely retrospective using past reports and interviewing key informants. And so, as with any kind of project, there's, a kind of difficulty in generalizing to other systems because, these were retrospective and kind of reports of what had happened. And in addition, as we went through the final reports, we noticed that those could often be subjective based upon who was writing the report. And so some were very detailed and included a lot of data, and others, were more kind of narrative and kind of spoke to like larger systems change. So it all depended on who was kind of, writing the final report. However, based on our findings, we do have recommendations of, thinking about system of care improvement moving forward. So it was clear with that state and federal mismatch that a landscape of state and federal policies are needed in order to understand for your particular state or organization, how funding priorities and procurement situate within, kind of what SAMHSA wants or federal funders want relative to what states are actually able to do. And a need for focus on payment and hiring structures that can really sustain ongoing grant initiatives. So each time, a new grant is awarded, new positions need to be established. And so finding a way to kind of streamline some of those organizational pieces. The other thing we noted was the need for exploring mental health parity and reimbursement, especially in kind of a publicly funded, Medicaid landscape, to really understand, is behavioral health reimbursement commensurate with other types of health services, and what that impact is on long-term sustainment of the behavioral health workforce, which is really important to think about, as we're trying to build systems of care. We want people to stay in the system of care, and so we need to reimburse them and pay them adequately. The other thing that we noted, I think as a lesson, was to not rely solely on historical knowledge. So that was kind of the impetus for David, Danny, and I to do this research project, was to have a source to communicate between grants about kind of lessons learned and what was really kind of happening in these different system of care expansion awards. So we're not having to kind of rely on people who have been around for such a long time in order to give us kind of the backstory behind why things are the way they are. And, it's really important, and that's why we're here today, to speak outside of CAMHD in order to understand, what are other systems doing? How can we learn from other systems? And are there things that are, kind of aligned or misaligned? And, how can we hui together and learn together? And a lot of the things that arise was kind of these principle-based solutions around trauma-informed care that really kind of resonated with us as being kind of the big kind of meaty things of system of care expansion. So I think that's all we have. I'll close this out. Thank you so much. This is a QR code to the article that's associated with this presentation. It just got accepted for publication this week, so it should be out soon. But the QR code takes you to the preprint. So if you want to read about everything we just talked about, please go to that, and I'll drop the link into the chat too. Awesome. I think we have time for questions. Suki, if you want to jump back on.
Hey everyone, what a wonderful presentation. And I think if you want to go ahead and stop sharing, then we can see everyone on the screen. And so we can open it up for questions. We've got time for 1 or 2 questions before we transition to our next break. Please feel free to drop anything in the chat. And if not, please send the speakers off with some love and applause for taking their time to pull all this information together. I'm very excited for this preprint that is coming out. I have a long history of implementation of systems of care in the state of Tennessee. And I have to say that I felt very encouraged by a lot of those themes and lessons learned. I was like, oh yeah, we're not the only ones. I think there's so much to be said for translating, you know, what's happening in a state, especially an island state like Hawaii, to other aspects of even, you know, rural communities, statewide systems of care in mainland USA. So I'm very interested to know if this resonates with other folks. And so please feel free to ask any questions of our presenters, and check out that preprint. Again, this session is recorded, so you can watch an instant replay as soon as this session ends, and you can access all of the resources either from the main reception page or by clicking on that icon that looks like a stack of paper. So I am not seeing any questions in the Q&A, and lots of thank yous, and I see all the hearts and the applause. Thank you all so much. So any last words before we transition, my friends?
I'll just quickly say, just really grateful to be here. Thank you, Suki, for helping us moderate. And we're just really grateful for the opportunity to present, and, you know, would love to hear if you have any questions about our work. You know, we can drop our emails into the chat if you have additional questions later.
Yes, please do. And, you know, the other thing I was reflecting on as I was thinking about the breadth of trying to really analyze 30 years of system of care implementation experience is we should all do that. I want to do what you did. I am sort of a hoarder of paper, and I have lots of old SOC material that's like, just in case somebody asked me for this at one point in time, because, you know, that information, like there's so much institutional knowledge that leaves. And I like just watching those project director names change, you know, from grant to grant to grant. And it's so remarkable that you all have taken the time and energy and resources to help not only your state, but the rest of us understand what some of these themes are and how we can learn from your experiences, especially for those communities that are still kind of getting into this work or might be newer. And I will underscore one of the main points that you had around sustainability, which is that begins before the grant. And so if you've never heard that before, please take that home, underline it, highlight it. That's a really important one. And we can't do any of this without both interagency collaboration and full meaningful integration in partnership with families and the young people that we work with. So critical. Those are kind of the two, I hate to use the term pillars, but they're kind of like those two foundational pieces of really strong systems of care. So thank you all so much for sharing your wisdom. I even love the title of your last grant, Data to Wisdom is really perfect. So thank you to the speakers. Thank you all for joining us today. This has been an amazing summit. I'm so excited for our very last session, which is coming up after another 30-minute break. I'm going to go outside and see if I have any strawberries in my yard that are growing yet. It's May. That's when they come out here in Tennessee. So I will leave you with an introduction to our next keynote, which is the Juvenile Justice and Mental Health panel. This one is not to be missed. It will focus on the intersection of juvenile justice and mental health and explore avenues for systemic change. And again, please complete the feedback survey, which will be available on the reception page at the end of the day. So please go take care of yourself, enjoy this break, check out the booths, check out the wellness room, and we'll see you all on the other side of the break. Thank you all so much.